Hello, thank you for participating in BEST, a breast cancer screening program from Texas Tech University Health Sciences Center, El Paso. Today, we will be talking about breast cancer and the importance of getting screened. We will be discussing what is breast cancer, who gets it, risk factors, warning signs, the importance of getting checked, screening mammograms, and common barriers and solutions to getting tested. It is important to get screened for breast cancer because breast cancer is the most common cancer among American women. About 1 in 8 U.S. women will develop invasive breast cancer over the course of her lifetime. Every 2 minutes, a woman is diagnosed with breast cancer. Every 13 minutes, a woman dies from breast cancer. During 2018, an estimated 300,000 women were diagnosed with breast cancer in the United States. In 2018, about 40,000 women died from breast cancer. In El Paso, during 2018, about 490 women were diagnosed with breast cancer, and about 91 women died from the disease. Breast cancer is the most common cause of death from cancer among Hispanic women in the United States. Before we talk more about cancer, we need to understand our bodies. Cells are the basic building blocks of our bodies. Cells that have similar functions come together to form tissues. Tissues make up the organs of the body. All of our organs have different functions, and it takes all of them working together to help us function and live. What is a tumor? The human body is made up of many types of cells. These cells grow and divide in a controlled way to produce more cells as they are needed to keep the body healthy. When cells become old or damaged, they die and are replaced with new cells. Sometimes this process goes wrong and new cells form when the body does not need them. The extra cells may form a mass of tissue called a tumor. There are 2 types of tumors. One is a non-cancerous tumor, also known as benign. It is not cancer, does not spread to other parts of the body, and normally does not put a person's life in danger. An example is something called a fibroadenoma. Second is a cancerous tumor, also known as malignant. It is made up of cancer cells that grow out of control. They can spread to other parts of the body by breaking away from the tumor and entering the bloodstream. The tumor can hurt tissues and organs. An example would be breast cancer. What is breast cancer? Breast cancer is a malignant tumor that has developed from cells in the breast. Usually, breast cancer either begins in the cells of the lobules, which are the milk-producing glands, or the ducts that drain milk from the lobules to the nipple. Less commonly, breast cancer can begin in the supporting tissue of the breast. Who is at risk? The average age to get breast cancer is around 60 years old, but it does occur earlier and later as well. It occurs in all racial ethnic groups, including Hispanics. Both men and women can get breast cancer, although it is rare in men. Hispanic women and African American women are diagnosed at earlier ages than women in other groups. The average age of breast cancer diagnosis in Hispanic women is 58, whereas in whites it is 65. 5-year survival rates among Hispanic and African American women are lower than in other groups in El Paso. Certain things can increase your risk, but do not mean that you will get breast cancer. Some of these things you cannot change, such as your family history, your race, certain changes in the genes, the age of starting periods, age of stopping periods, or getting older. There are also other things that can increase your risk that your doctor can diagnose, such as having dense breasts, having a high bone density, and having a biopsy that finds hyperplasia, which means an increase in the number of cells. Lifestyle factors that can be changed. Other risk factors are not being active, a poor diet, high in fat and lacking fruits and vegetables, drinking alcohol, never having children or having children after age 35, taking hormones, radiation exposure, being overweight or obese, and smoking. You may be able to change your risk by changing some of these things. So some things that you can do to decrease your risk are plan your pregnancy, exercise and be active, breastfeed your children as long as you can, do not smoke, eat healthy, less fat and have more fruits and vegetables, and limit alcohol intake. There are certain myths surrounding breast cancer. An injury or hit to the breast causes cancer. No. Bras cause breast cancer. No. Caffeine causes breast cancer. No. Although it can cause pain because of fluid, but it does not cause breast cancer. Deodorants cause breast cancer. No. Breast cancer family history and genetics. Most breast cancers occur in women without a family history of breast cancer or genetic changes. Women with 2 close family members have double the risk. Some women with multiple family members with breast cancer may have abnormal changes in their genes called BRCA1 or 2. These gene changes are not very common and only occur in about 1 per 1,000 people, and only occur in about 3 out of 100 breast cancers in Hispanics. If you have one of these abnormal gene changes, you have up to a 65% chance of getting breast cancer. If you have a strong family history of breast cancer, you may be referred to a genetic counselor to learn more and to see if getting tested for these abnormal changes in the genes is right for you. What are the warning signs of breast cancer? Often, there are no warning signs for breast cancer, especially early on. Sometimes a woman herself notices a painless lump. Other warning signs that often occur late are a new lump in the breast or underarm, thickening or swelling of part of the breast, irritation of breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, including blood, any change in the size of the shape of the breast, or pain in any area of the breast. If you notice any of these, you should see a doctor right away. It is important to get screened. Finding cancer early means longer life and less treatment. If you find it early, you may not need radiation or chemotherapy, so you won't experience the side effects or the costs of these treatments. If cancer is only in the breast, 99 out of 100 women survive 5 years. Once the cancer spreads to different parts of the body, only 24 out of 100 women survive 5 years. What are the screening guidelines? Women between the ages of 50 to 75 years old should have a mammogram every 2 years. Women between the ages of 40 to 50 years old should discuss with their doctor to see if screening is the right decision for them. Should I get screened? Should I get screened if I don't have a family history of breast cancer or if I don't have any symptoms? The answer is yes. Remember, women don't have symptoms until late, so you should get tested. And although family history is a risk factor, most women with breast cancer do not have a family history. What is a mammogram? When you have a mammogram, your breast is briefly squeezed between 2 plates that are attached to the mammogram machine. There is a plastic plate on top and a fixed X-ray plate on the bottom. The bottom plate holds the X-ray film or the digital detector that makes the image. A mammogram can find cancer early and detects most, but not all cancers. What does it feel like to have a mammogram? Although the compression can make people feel uncomfortable and can even be painful for some women, it only lasts a few seconds and is needed to get a good picture. A mammogram doesn't last very long. The time you're exposed to x-rays is just seconds. The entire procedure for a mammogram takes about 20 minutes. Some possible results from a mammogram are normal results. Another result is a cyst. This means there is fluid collected in a ball. Or a calcification, meaning that calcium has developed in the tissue. This can be normal, but can also happen in cancer. A doctor can sometimes tell the difference and may need further testing. A fibroadenoma is a lump of cells that are normal. The doctor can usually tell, but may need more tests. Mass means a lump of cells, but the doctor is not able to tell what they are and will need more tests. Or dense breast. This means that x-rays could not pass easily through the breast. This usually happens in younger women. More testing may be needed in some of these cases. There are different types of breast examinations. One is a clinical breast exam, when a doctor examines your breast for lumps. Another is a breast self-exam, where you check your own breast regularly and inform your doctor if there are any changes. Although these tests can be useful in many situations, a mammogram is the best test to check for breast cancer. Are women getting screened? Only about 7 out of 10 women are getting screened. Unfortunately, Hispanic women are less likely to get screened. What benefits do you think screening makes? The benefits of screening are to prevent breast cancer and for early detection. So why do you think some women aren't getting screened? Some women don't get screened because of different barriers. Some of these barriers can include embarrassment. Perhaps a spouse or a significant other does not want them to reveal their breast to another. Being uncomfortable with the male doctor. Remember, all doctors and medical staff have taken an oath to ensure the privacy of all their patients. There may also be issues with transportation and lack of insurance. Sometimes a doctor does not recommend a breast exam. There's lack of awareness, women not really understanding how important that screening is. Fear of the test, lack of time. Some women believe they will not get cancer or that their health is in God's hands. Fear of pain, lack of symptoms. There's also fear of radiation exposure, but remember, as we said in the mammogram, your breasts are only exposed to radiation for a few seconds. Fear of bad results, and sometimes communication barriers. Remember, all women are at risk. Get screened today for your family. They need you to be healthy. If you or someone you know is interested in getting a mammogram, please call Bertha Macias at 915-215-5582 to see if you are eligible for the BEST program. Thank you for your time.